Hello everyone and welcome back to my YouTube channel. If you're here for the first time, hi, my name is Bosabi Imoliayo. I am a registered nurse and midwife. On this channel, I talk about nursing, healthcare, and my lifestyle generally as a nurse. Recently, I relocated from my home country, Nigeria, to Scotland, United Kingdom to continue my career as a registered nurse. And I have been sharing my experience, the process, and all the things that have been happening regarding my relocation. In today's video, I am going to be talking about the exam that I just passed, the NMC UK Osce exam. I'm going to be talking about different things regarding the exam, the contents, the format, passing, and other important information that I feel you should have if you're willing, if you're intending to take that exam. A little disclaimer here, I am not a NMC OSCE trainer. I am just sharing my personal experience about the exam, what I know and what I feel is important for future candidates to know before going for the exam. So let's go. OSCE actually stands for Objective Structured Clinical Examination. It is a practical exam basically. And the NMC UK OSCE is the second test of competency that you must take as an international registered nurse if you want to become registered as a nurse in United Kingdom. The first one is the CBT, which is a computer-based test that you can take in your home country. The NMC UK OSCE exam can only be taken in United Kingdom. You cannot take it elsewhere. You have to come down to United Kingdom to take this exam. So it is either your employer sponsors you or you can self-sponsor, which means that you can come to the UK on your own, pay for the exam, register, and also take the exam. The center where I took my exam is the University of Northumbria in Newcastle in England. So I traveled down from Scotland to England to take my exam in that particular center. There are a lot of other centers in the United Kingdom where you can register for the exam, and the names of these centers are all available on the NMC UK website. The exam costs about £794. And if you're going to be receipting the exam, probably because you did not pass all the 10 stations at once, the price for receipt is relatively cheaper than the actual price of the main exam, except when you fail too many stations. So have it at the back of your mind that the exam costs about £794, which, to be honest, it's not a joke. It's not little money. It is a lot of money, which is why it is important that you take caution and know what the exam contains before you go for the exam. Now, talking about the setting of the exam, or like what we are used to probably back home in Nigeria, where you have like a big hall and you have like 15 stations, where you have like 6 procedure stations and 6 question stations. Then you guys go in circles. You can have like 2 to 3 resting stations, and you guys take like 5 to 10 minutes per station and keep going in circles till you're done. It is different. And back in Nigeria, the procedure stations and the question stations are actually related to each other. But here, it is really not like that. There are a lot of differences. So about the setting, for example, it is just you, the examiner, the actor, somebody that is probably going to be acting as your patient, and or probably a mannequin that you'll be practicing a procedure on, or you're just there, your examiner, the table and chair which you're going to be writing. So it's a closed space. It's just you and the examiner, and there are going to be cameras there catching everything you're saying, cameras, microphone, because it is not just that one person that is going to assess. There are going to be other people assessing that particular exam. So it's not just your examiner, and there's going to also be a timer boldly, like it's going to be very obvious. You will see the timer, so you know that okay, nobody is cheating you, and the time for each procedure, each station actually differs. For this exam, it is different depending on the registration you want to gain. For example, the adult nursing NMC UK OSCE is different from the OSCE of mental health nurses, is different from the children nursing OSCE, and it is also different from the midwifery OSCE. So it is important that you know what you're going to, if you're registering, what you're registering for before you even pay, especially if you want to self-sponsor. If the CBT you wrote is the adult nursing CBT, then you are also going to be taking the adult nursing OSCE. I hope you get my point. So it is not the same set of questions for somebody that is a midwife. It's not the same set of procedures for somebody that is going to do adult nursing OSCE and the same person that is going to do children nursing OSCE. It is different. So you have a total of 10 stations in the exam for the adult nursing OSCE, which was the exam that I took. So the 10 stations are broadly classified into 4 different subcategories. You have the API, which stands for Assessment, Planning, Implementation, and Evaluation. Those are 4 different stations. Then you also have the clinical skills. Then you have the professional values as well as evidence-based practice. You are going to be tested in all these 4 areas. For the professional values and the evidence-based practice, they are written stations. The API are all areas where you're expected to carry out a procedure, while for the clinical skills, it is a mixture of written stations and practical. So now I'll be talking about each of these 4 subcategories, their contents, and what you should expect. Now, starting with the API, for the assessment, you're going to be assessing a patient. You're going to be doing an A to E assessment, which is airway, breathing, circulation, disability, exposure. You're going to be filling some assessment materials or some assessment tools, which could be the news charts, it could be the 60ITs, it could be your MOST tool, it could also be PHQ-9, and you may also have the Glasgow Coma Scale. It depends on what you get. So when you're being trained for your OSCE, you would be trained on how to use all these assessment tools and the different scenarios in which you will have to use them, the different patients that you have to use them, and when it is appropriate. So when you get to the exam hall, you would have to use one of those assessment tools to assess a patient. You do your A to E, you check the vitals and ask relevant questions based on the patient's past medical history, their current situation, their challenges. You have to carry out an assessment and you will do this for 20 minutes. Then you move on to the planning. For the planning, that is where you have to do like a nursing care plan for the patient that you have assessed. You would have to write 2 priority nursing diagnoses. You plan your care, and when you come back to recheck, and the planning station is 14 minutes. After the planning station, you move to the implementation station where you have to do like oral administration of a medication. You'll be doing this in 15 minutes. That is the implementation. You will have to carry out all your checks for rights of drug administration, your right patient, right route, right time, right dosage, ensure that the prescription is valid, check expiration date of your drugs. The regular things that you would do if you're administering medication to a patient is what you'll be doing in your implementation station. The medications you will be administering is going to be dependent on the type of patients that you have. Probably you have a fracture patient, an Alzheimer's patient, a patient that probably is prone to bed sores. You could have patients that have a chronic heart failure, ectopic pregnancy, end of life, homelessness, pneumonia, subdural hemorrhage, subdural hematoma. It could be asthma. It's going to be entirely dependent on the type of patient that you get. So the E part of the evaluation is where you have to hand over your patient either to a nurse, a GP for continuity of care. You have to hand over that patient and you have to be using the tool called the S-bar for this process. So that is the API. In summary, it's broad, but in summary, that is what the API is about. Now moving to the clinical skills session. You would be doing 4 clinical skills in addition to your API, which is already 4 stations. That's making up 8. And you also have other 2, which is the professional values and the evidence-based practice. So for the clinical skills, there are about a total of 21 skills that you may be assessed from, and it could be any of them. Some of them are administration of inhaled medication, suppository, blood glucose monitoring, bowel assessment, catheter specimen of urine, fine bore nasogastric tube, fluid balance, in-hospital resuscitation, intramuscular injection, intravenous flush and VIP score, nasopharyngeal suctioning, nutritional assessment, oral care plan, oxygen therapy, pain assessment, peak expiratory flow rate, pressure area assessments, removal of urinary catheter, subcutaneous injection, mixturing urine and urinalysis, as well as wound assessment and aseptic non-touch technique. So you will be assessed on any four of all those skills that I mentioned. So you have to learn everything. Because I know it's a lot, right? But the thing is that you should not be so scared, because most of these procedures are things that you have already been doing as a nurse. Remember, you cannot come to take Osce if you are not already a nurse back home. So obviously some of these things are things that you are already familiar with from your regular clinical postings in school, working on the ward as a nurse. So everything is not going to be like a totally strange thing that you have to learn. There are things that you would already be familiar with. You just need to know how it is done UK standard. Basically, that is just it, and how they do their own, because there are some differences in the values, baseline values, as which will be different from what you have from your own country. Then the last 2 stations are your evidence-based practice stations, as well as the professional values. So what happens in the evidence-based practice station is that you would be given a research article to read, and you have to summarize the evidence or the main points in that article and write it out as answers to your question. Then for the professional values, you would be given a scenario that could happen either on the ward or outside the ward, and you will be asked how you will handle that situation as a registered nurse. For the evidence-based practice and the professional values, there are 15 articles and scenarios each, which means that you could be asked 1 out of the 15 scenarios for professional values, and you could also be asked 1 out of the 15 scenarios as well. I'll say scenarios, or given 1 of the 15 articles for your evidence-based practice. So that is a brief summary of what the Osce exam that I took contains. It's a lot of information to take in, but don't be afraid. You are a nurse, and most of these things are not totally strange to you. You just need to learn how to do it the UK style. So talking about passing and receipts. So if you take 10 stations on the day of your exam and unfortunately you did not pass everything, you would be opportune to have 2 receipts. So you take the first exam, then you have 2 extra receipts. So if you have like your first exam, for the first sitting, you pass like maybe 8 out of 10 stations, you will be going back to receipt the 2 stations that you failed. It's not like they're going to give you an entirely new station to take if you fail. You're going to have to retake the 2 stations that you failed. So probably you failed the implementation station, and maybe you also feel like administration of inhaled medication. When you're going back for your receipt, you're going to be receipting the same station, which is the implementation or administration of inhaled medication that you failed. So I'll leave some links down to some YouTube channels that I feel would give you guys more visual representation of what the Osce looks like. And if you still want to view my videos about my relocation experience, I'll leave a link below in the description box. But if after everything I've said, you still want to have like a one-on-one conversation with me regarding any part of the process of relocation process or any part of the exam that I mentioned in this video, I'm going to leave a link down in the description box where you can book a one-on-one call with me and we can have a private conversation. Because you guys because the amount of times you guys say, oh, I want to talk to you personally about this thing, because sometimes I feel like I shared all the information that I need to share on my channel, but it's just like you guys feel it's not enough, or probably you have some questions that my videos did not answer. Then I'm going to leave that link down. I'll leave it at a discounted price from today till next week Friday, because I am free for the next couple of days, and If I'm free, I should have your time, right? Besides, I've not really had time to talk to my audience for months because of the whole relocation process. So I'll leave the link below. You can book a call with me. You'll be given a date and time that would suit both of us, you and I, and we will talk about probably your exam or any part of the process that you want me to talk about. And if you want to see the rest of my videos, you can click here and check on my playlist, and I'll see you in my next video. Bye.